Hey everyone, it's me Preeti Gurung. Welcome back to my channel. I'm here with another topic IPSG, that is International Patient Safety Goals. So let's begin IPSG. So there are total 6 IPSG that every healthcare provider should follow to improve the quality of patient care and to improve the safety of the patient. So there are total 6 goals. Now we'll list out the goals, then we'll see one by one. So first goal is identify patient correctly. Second one is to improve effective communication. Then the next one is improve safety of high alert medications. The fourth one is to ensure correct site, correct procedure and the correct patient surgery. Then the fifth goal is to reduce the risk of healthcare associated infection. The sixth one is to reduce the risk of patient harm resulting from fall. Now we'll see one by one. So first IPSG is identify patient correctly. It is the process to improve the accuracy of patient identification. So we will be using identifiers as per the policy. So mainly two identifiers are used. UHID, that is unique hospital identification number, and the full name of the patient. Then next is IPSG is very important, so we have to make sure we follow IPSG 1 while providing care, while administering medication, before we perform any procedures, before we take any samples like blood sample, blood culture, etc. Then before administration of blood products. Lastly, we have to improve the patient safety. Then the next one is to improve the effective communication. It is the process to improve effectiveness of verbal and non-verbal communication among caregivers. While giving handover, proper communication is very important. Then next process for reporting critical values, like remember, write down and read back. Whenever you are taking telephonic orders, like many times we get called from lab for critical values, we have to write down and read back. And about ISBAR, we all know we have to identify situation, background, assessment and recommendation. It is created to improve the safety of the patient. It provides a standardized approach to communication which can be used in any situation. The next caution, where communication may fail due to incompetence, due to poor teamwork, because of lack of trust, casual approach, lack of support from team, supervisor, administration, breaking rules, policy made by the hospital can also hamper communication. Then the next one is IPSG 3, that is improve safety of high alert medication. It is the process to improve safety of high alert medication. It is the process of the safety of LASA medication, look-alike and sound-alike medication. Like for example, look-alike medication example are Electone and Naproxen, tablet Avil and tablet Lasix, injection Atropine and injection Pyrolate. And sound-alike medication example are Cefuroxime and Cetirizine, Amlodipine and Atorvastatin. And friends, comment down below LASA drug name you know. Then the next is common errors while administering drugs. Allergy is not mentioned. It is very important to mention allergy in drug sheet to improve patient safety. Incomplete information in drug sheet. Always check your drug sheet whether it is filled fully or not, like generic name, dose, frequency, date, etc. to be filled. Inappropriate use of abbreviation must be prohibited. Inappropriate units, like for example, you have to give 10 units and thereby mistakenly it is written 100, so there can be a medication error. Then inappropriate labeling. Always make sure while preparing your medication tray, medication must be labeled to get identified easily. Avoid environmental distractions like noise, improper light, heat are some of the factors. Then machine error, like if the order is to give 3% NS via infusion pump 10 ml per hour for 10 hours and you have set in the infusion pump, then afterwards you go and check patient side. After 1 hour you see that 70% quantity of the bottle is infused to patient due to machine or technical error. So this can also make the life of the patient in danger. So make sure the equipments that you are using, it must be checked on regular basis. The next, reconciliation not done. On the day of admission, reconciliation must be done. The medication which the patient is taking on regular basis must be mentioned in the drug order sheet. Then communication error. So the communication must be clear between the doctors and the nurses to nurse and the other healthcare team members. Then the next is incomplete documentation. So whenever you go for administration of medication, you must check your drug sheet. It should be properly filled and fully filled. Then only you go for the administration of medication. Then how to improve the safety of medication? So how we can improve that? So first is proper labeling. Take a few minutes and label your medications. Then don't forget to ask the allergy to the patient before administration of any drug. Make sure proper storage, separate cupboards for medication including high alert medication and concentrated electrolytes. Next, proper drug calculation must be done before administration of drug. If you have doubt, then ask or confirm with your seniors or on-duty doctor. Also, we have seen previously reconcile the medication if required. That is very important. Follow the narcotic policy as per the hospital requirement. Lastly, document medication error and do report. Then, the next IPSG 4 is ensure correct site, correct procedure, and correct patient surgery. For that, we need to make sure before we send to the patient in the preoperative room, we need to consider preoperative checklist must be filled, site marking must be done by the doctors, consent must be taken and signed by the surgeon before we shift the patient, necessary investigation must be done as per the doctor's order, and reports must be attached to the file. Most important is sign in, time out, and sign out. So, sign in before induction of anesthesia, time out immediately before starting procedure, and sign out immediately after wound closure. These things must be done in the operation theatre. Wrong patient, wrong site, wrong procedure can lead to sentinel events. So, stay alert. Next is IPSG 5. Reduce the risk of healthcare associated infections. So how we can reduce that infection? First is proper hand hygiene. Then 5 movements of hand hygiene. Before touching a patient, before clean or aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surroundings. To reduce the risk of infection in hospital, infection control nurse and link nurse plays a vital role in hospital. Standard precaution must be followed. Care bundles including COTI, CLEPSI, SSI, VAE, NSI must be maintained and done. Next is biomedical waste management. It should be done by all. We have to teach the patient and relative also regarding this. Next is vaccinations. Staff vaccination must be completed as per the hospital requirement. Barrier nursing, reverse barrier nursing, isolation room pressure should be maintained as per the patient disease requirement. Next is IPSG 6. Reduce the risk of patient resulting from fall. So for that we need to do initial assessment and reassessment of the patient. Fall risk assessment, scale monitoring should be done on admission every shift or if the patient condition changes. To prevent fall, we have to make sure side rails must be up always. Call bell should be near to the patient so he or she can call us whenever he or she need assistance. Signage board. If the floor is wet or on any use, signage board must be there for the alertness. Walking aids must be available as per the patient needs. Keep the floor dry always to avoid fall and use of grab bar must be done. Patient and family education should be done in every shift. And lastly, documentation should be done. I hope this video was useful for all. If you like this video, do not forget to like, share and comment. And if you have still not subscribed, so first subscribe to my channel and press the bell icon to get notification of my YouTube video. Thank you for watching.